Hey, I'm Barbara O'Neill, and if you're over 50 and struggling with joint pain, inflammation, or stubborn health issues like fibroids or arthritis, this might just be the solution you've been searching for. Today I'm sharing the incredible benefits of castor oil combined with turmeric, a natural powerhouse duo that can transform your health. Whether you're looking to ease pain, reduce abnormal growths, or support your body's healing process, this simple remedy is a game changer. Stick around to learn how it works, why it's so effective, and how you can start using it today for remarkable results. And as a special thank you for joining me today, we're giving away 100 free copies of my best-selling book to subscribers. So, if you haven't already, make sure to hit that subscribe button and leave a comment about why you want to win my best-selling book. Internally, turmeric. Yeah. So how can turmeric be taken internally? You can take it in quite large doses. So I had an injury in my shoulder once. In fact, it was not responding, and so I had a scan to find out what was happening in there, and it showed that I had a full thickness tear of my supraspinatus tendon. Your supraspinatus tendon is the tendon that sits in that dip in your humerus, and your supraspinatus tendon causes your arm to go up. From about there, it's the deltoid. You know, the deltoid is this muscle here that kicks in. So I had a full thickness tear, and I had a 1 centimetre, gap. So I went to an orthopaedic surgeon to get his opinion, and he said, that will need surgery to heal. But he said, we do keyhole surgery now, and you know what they do? They take it up on their computer and they've got a little cartoon type illustration of what he would do. It was very impressive. I said, whoa, well that looks fairly non-invasive, because he said you've got a 1 centimetre retraction. And he said that cannot heal unless it comes together. But I was a public patient because I do not pay into private insurance. So he said, you know, it's going to take a while. And I said, what if I just hire you to do it? How much would you charge? He said, $2,000. And I thought, to have it fixed so quickly, one might consider that. He said, but then you'd have to pay the anaesthetist, and then you'd have to pay the surgery. I said, forget it. And so he put my name down, but you know, I found out later, he put my name down for about 10 months. And I thought to myself, why did he put me down for so long a way? I think he thought that I could do it, because he couldn't believe how much I could do already, and he could see that I was fit. And I could, by looking at him, he was in his early 50s, he was very fit. You know, and a fit person appreciates and acknowledges another fit person. So now that I knew exactly what was happening, I went home and I started to do comfrey poultices. We have comfrey growing. It was winter, so I was grating up the comfrey root, and I was putting a comfrey root poultice on for 4 hours, twice a day. It was painful, and it would often be painful. And so I was taking internally turmeric, and I was taking 6,000 milligrams of turmeric capsules a day. Now with the poultice on and the 6,000 milligrams of turmeric a day, I was getting 8 out of 10 pain down to 2 out of 10 pain. So that's very impressive. And I had a fairly heavy schedule. I had the retreat, and then the following week I was travelling and I was giving meetings. So before the meeting, in fact, I had some tops that had big sleeves, so I could put the turmeric poultice underneath and you could barely see it. So that's what I did. And I did it as long as I needed to do it. So when my pain began to subside, I started to just do the poultice once a day. So that, I think we did it twice a day for about 3 weeks. And then I started to ease off. And because it wasn't so much pain, I brought it down to 3,000 milligrams. So I just brought it less and less and did this less and less. As I continued with the turmeric regimen, the progress was truly remarkable. Taking 6,000 milligrams of turmeric capsules daily and applying poultices twice a day for 3 weeks brought incredible relief. My pain, once at an unbearable 8 out of 10, dropped to just 2. Gradually, I reduced the dosage to 3,000 milligrams and lessened the poultice applications as my condition improved. Over time, I regained full functionality with no pain or signs of the injury. The transformation was astonishing. Turmeric proved to be a powerful ally, both internally and externally, showcasing its exceptional anti-inflammatory and healing properties. Vitamin C intravenously. I have met some people who are managing their cancer well, and they claim that what has helped them a lot was the vitamin C intravenously. There's no doubt about it that it certainly helps, but I guess you have to find a physician who's willing to do that.
And also infections can be treated that way.
IV.
It is claimed IV, yes.
Yeah.
Vitamin C again, but this time liposomal, in a liposomal form.
It is the most effective vitamin C, is liposomal. Are you familiar with that? I know my daughter was making it for a while. I think there's a way that you can make it. We just buy our vitamin C. What you'll find when you have a health retreat, you get very, very busy. And you look at ways that you can save your time. We grow a lot of turmeric. We've got huge amounts of turmeric. Someone said, why don't you dig it up and make your own powder? I could probably do that if I didn't sleep. You'd almost have to employ someone, because when it's a big thing to dig it up, it's very deep, then you have to wash everything, then you have to cut it up, and I think in the time of trouble we will be. But you see my point, that when you have a health retreat and you're very busy, and when you first start, you won't have much stuff. In fact, all our staff are multitasking. Everyone becomes multitasked. That you have to be very careful that you do not overwork. That's very, very important. How do you guard against that? You go to bed early every night, and if you've got extra to do, you're far better to go to bed at 8 p.m. and get up at 4 a.m. And you'll have a couple of hours there if you've got extra things to do. That'd be easy here in Sweden. It's light. And in the summer, yeah. And you've also must exercise every day. If you don't, you cannot give the exercise lecture. Sorry, but you can't. Yes?
How do you do the liposomal vitamin C?
I can't tell you, but you can Google that and find out.
It's a form of transportation, so you're transported to the cell rather than having it in the bloodstream. So it means that you can make full use of it. But there's a lot of controversy around it, so it's difficult to say whether it's good or whether it's bad.
And you should also have the right type of vitamin C, the right powder.
Yes, definitely. As we talked about earlier with the bioflavonoids and so on. But it's you encapsulate it in fat, and that will transport it to the cells rather than lying in the blood cells, in the bloodstream.
Yes.
You don't use the liposomal vitamin C, or?
No, we don't.
Because you can buy it somewhere.
No. I also don't have anything to do with the ordering. Our office manager does that, and I just leave it there. You know, it's like Moses. They said you have to shed your workload. When it comes to managing health, I've seen the benefits of intravenous vitamin C, especially for cancer and severe infections. Liposomal vitamin C, however, is an incredible option for daily use, as it's highly bioavailable, efficiently transported to cells for maximum impact. While I don't make it myself due to time constraints, it's a valuable supplement. Managing a busy health retreat has taught me the importance of balance, resting well, delegating tasks, and maintaining daily exercise. These habits are essential for sustaining energy and focus. But many people don't promptly answer nature's immediate call, and their colon gets into the habit of not going when it should. And there's something else you can wear on your colon for a few hours a day, and it's a castor oil compress. Castor oil is an oil that penetrates deeper than any other oil, and it'll break up the congestion in the colon and help you to pass with ease. So if someone tends to constipation, it's very important that they invest in a $2 plastic stool from the Crazy Clarks. Do you have Crazy Clarks? $2 shop, or I don't know, something like that. Okay, those shops. Or they go to Bed Bath and Beyond and invest in a squatty potty. So take the pressure off there and start drinking more water, start wearing the castor oil compress on there. And if you weren't in the lecture that showed how to make compresses, you can Google Barbara O'Neill poultices, and in the poultice lecture it shows you. But it's a few layers of cloth with castor oil on it, put on the abdomen, cover it with plastic. Usually your clothes will hold it there. In fact, one lady who came to our program, she said, I used to have irritable bowel. And when I had irritable bowel, my husband, who's a doctor, came in and told me what he was going to do is going to be cortisone and anti-inflammatories, and if that didn't slow it down, we'll just open you up and cut that part out. It actually defies reason, doesn't it? Do you know, I'm not criticising doctors. They do the best they can. You know, poor doctors, people beat themselves up, and then they come to the doctor and think there's going to be a quick fix, but there actually isn't. There isn't a quick fix. The body can heal itself. It's little by little by little it breaks down. It bears so long under abuse. And so it's little by little by little, given the right conditions, that it can start to build up and heal again. So this lady decided not to do what her doctor husband suggested, and she'd heard about the castor oil, so she started wearing castor oil compresses on her abdomen. And she said, I healed myself of irritable bowel with castor oil. So castor oil will penetrate deep, and it'll help to ease any inflammation. It will also penetrate deep and break up any lumps and bumps in the area if the person has constipation. You see, herbs are synergistic. They work with the needs of the human body. That's the good news. So let's come down here, and oh dear, there are those horrible little things called hemorrhoids. What can you do to get relief there? Squatty potty, so you take pressure off them. But there are a few things you can do. You can soak a cotton ball in castor oil and shape it to the shape of your little finger and put it in the freezer. Now it will take about 4 days to freeze. And once it's frozen and it's, you know, solid, you can insert it and leave it in there overnight. And the castor oil brings great relief to that hemorrhoid. Castor oil, with its deep penetrating and anti-inflammatory properties, works wonders for reducing inflammation and easing congestion. It's highly effective for relieving digestive discomfort, constipation and hemorrhoids. When combined with turmeric, its benefits are amplified due to turmeric's potent antioxidants and anti-inflammatory effects. This blend can be applied to the abdomen or affected areas to soothe inflammation and promote healing. For hemorrhoid relief, soaking a cotton ball in the mixture, freezing it, and using it overnight provides remarkable comfort. Together, castor oil and turmeric offer a natural, gentle solution for various ailments, harmonising with the body to enhance overall wellness. Also, underneath the rib are gallstones. It can help to break those up. Round the back to kidneys, it can help to break up kidney stones. So there's a huge amount that the castor oil can do. But it's not a poultice, it's a compress. And as a compress, it can be used again and again and again. So this is how you make it. So you put a little bit of plastic down, and then with the compress, you put several layers. Now, if it's toweling, you might just put one layer, but if it's thin sheeting, I know I do a castor oil on my wrist every night, and I think I've got about 8 layers of thin sheeting on that. So there's your compress. The thicker the compress, the more oil it'll hold, so the more oil can go into you. If you use a paper towel, it'll all just break up. But if you use cloth, you can use it again and again. I've been using the compress I'm using now for, since I left home. No, actually, I made another one in Alabama. So I've been using it for 6 weeks. And then you put the castor oil on, and it'll be like a thick bubble, because castor oil is a very, very thick oil. So I'll show you how to put it on from another angle. So here's the plastic here, and here's the compress. And remember, we've got several layers. The thicker the compress, the more oil can go into you. And then when you put the castor oil on, you only put it on this much. That's all you put on, because it is so thick and it sits up like a bubble, and it'll take probably about 15 minutes to soak through. And when it soaks through, it takes up a little bit more of the area. And then you put it on your hot body, whether it be wrist, whether it be abdomen. When the heat from your body thins the oil, and it'll go out even more. I said to one lady who had breast cancer, I said, have you tried castor oil? She said, I'm not going to do that stuff. She said, it leaked everywhere. And I know what happened. When she poured the oil on, she poured this much oil on. And then it's got nowhere to go, except it's going to start dripping everywhere. And she is right, castor oil, you don't want that through your clothes, you don't want that through your bed. So it's important to appreciate what I'm saying about it's better to put a little less. So my compress now, of course, is totally covered because I've worn it every night. I've been wearing it every night for a couple of months, and I have no pain when I wear that. Now, one of the reasons I'm wearing it is because in the X-ray it showed a little bit of osteoarthritis on my joint here. And I know that there was something happening there because it was sore before I even fell on it. I have no pain if I wear that. And I'm so glad that's all I've got, because remember, when my mother was 51, she was a cripple in a wheelchair. So I'm really happy that that's all I've got. Remember, genetics load the gun, but lifestyle pulls the trigger. Could you add essential oil? You could if you want. Do you have to refrigerate it? No, you don't. I've got a little snap lock bag that I folded up and put it in when I travel. And so I'm just in the habit of putting that on every night. Consistency is the key. So if you have got a bone spur you want to break down, the castor oil will break it down, but you've got to be consistent every night, every night. So easy. I open it, put it on, bandage it on. It takes me about 30 seconds. It's easy. You wear it all day? You could wear it all day. Yep, if you want to. Now, about once a week, I put maybe another teaspoon on. No, not a special kind of castor oil. Any castor oil will do it. But it is true that the dark brown Jamaican is a little bit more potent, but we've seen amazing results even just with the clear castor oil. Well, they don't spray castor oil, so, I think there's not much difference between organic or non-organic. It doesn't have to be in a glass bottle at all. It can be plastic, and plastic's much more convenient when you're traveling, because remember, castor oil doesn't absorb anything. This compress is just a vehicle holding it so that it can go into you and start to break up unnatural formations. I do not suggest taking castor oil by mouth. What a relief. It can be irritating in the gastrointestinal tract, but it's very powerful from the outside. I met a lady that she said 20 years ago I was diagnosed with breast cancer. She said I was lying in the hospital. I didn't like what they were offering. And a delivery boy came in and she said to him, "Can I get a lift out with you?" She got out and she went to a friend's house by the sea, a little holiday house that she could stay in. And she heard about castor oil and she said, "I just wore castor oil 24/7. She said, "That was 20 years ago. I don't have breast cancer." Yeah. So the castor oil, little by little, broke it down. If you wear it on your abdomen, you would wear it for at least 5 hours, 5 days a week. Some people, if they wear it too much, it gets the bowels moving too much. But again, you're just watching your body's response. A friend of ours who developed a fibroid, and we were surprised she did because she exercises, plant-based diet, water, you know, she does everything. And we thought, she's only 30. And then we discovered that she's living on a farm next to a macadamia nut farm. And the sprays from the macadamia farm were enough to throw her hormones out. She was rushed to hospital with pain. They did a scan and they found a fibroid that was, let me go to inches, it was probably about 3 inches in diameter. So she decided to go on the yam cream. So tomorrow I'll be talking about hormones, and the yam cream helps balance the hormones. She wore the castor oil compress every night. She said at least 6 nights a week I'd wear it. And she had no more pain, no more rush to hospital. She had another scan, I think it was 4 or 5 months later, and the fibroid had come right down to, from I think it was 3 inches down to 1 inch. So that's the good news. It can break up things.
I've witnessed the incredible effects of castor oil. Applying it consistently, especially on areas like the abdomen or joints, helps reduce inflammation and dissolve issues like bone spurs, fibroids, or arthritic spots. When combined with turmeric, its benefits multiply. Turmeric's powerful anti-inflammatory properties enhance the healing process, making the blend even more effective. Gently massaging this mixture onto problem areas nightly can bring noticeable relief over time. Many have shared their success with this simple yet powerful remedy, as it works harmoniously with the body to soothe discomfort and promote natural healing.
And castor oil is something that penetrates deep into the body. I never advise taking castor oil by mouth because it can be quite irritating. So I'm going to show you how to make a pack. So here is, I think we're familiar with them, they're blueies. Oh, this is a greenie, but it's an incontinence pad. So what we do is we get those and we cut them and we take off that top layer and we put several layers in there. 1, 2, 3, 4, 5. I've got 6 layers of that oil sheeting in there. You see, the thicker the compress, the more castor oil it can hold, and the more castor oil that can go into your body. And what we do then is we tape the edges. And the reason we go to a bit of effort to do this, you can also stitch the corners, because this is a compress, so it can be used again and again and again and again. And the beauty of it is it has a plastic backing on it, and you want that plastic to protect your clothing. A castor oil compress is something that I apply to my hand every night. So you might notice I've still got a little bit of swelling in my hand. It's been only 8 weeks since I broke this. The X-ray confirms that my bones are healed, but there's still a little bit of swelling there because it was quite a serious break. So I've brought you over my castor oil compress, and I've used one of those sheets that the 15-year-old's knee went through, and I've actually got about 10 layers there, and I put that on my hand like this, and I bandage it, I'm getting very good at this because I do it every night. Because I quickly discovered my husband's not a nurse. He does it in a bit of a hurry and doesn't do it quite right. And so there's my castor oil compress that I will sleep with. I sleep with it every night. So why am I putting a castor oil compress on this? Because that was quite serious damage. My ulna was fractured, my radius was totally broken and out of place. Whenever you've got an injury, you've got the possibility of scar tissue building up. And so this is very good at stopping scar tissue developing. And many people have problems years later after an injury from scar tissue. So if someone maybe had appendix taken out 10 years ago, sometimes they get more problems now because of scar tissue building up from that. So castor oil will break up any unnatural substance. So it'll break up a bone spur. It'll break up kidney stones. It'll break up gallstones. It will even help to break cataracts up. So you can put a drop of castor oil on your finger and wipe it over your eye, then do it to the other eye. Could you put it in your eye? Absolutely. It's just easier to wipe it over your eye though, because it's so sticky. So if you know what castor oil does, you start to know where to apply it. When I was in I think it was Nebraska last year, a lady came to me and she was in her 70s. She said, my foot had this bunion on it, and the bunion came out about 1/2 an inch. She said, I've been applying a castor oil compress to it every night for 2 months and it's gone. So that's good news. So any bony formations, bone spurs, very good at breaking up bone spurs. Obviously it's not going to do it overnight, and it's not going to do it sometimes in a month. Depends how long it's been there, depends how big it is, depends how serious it is. I've known ladies to break up fibroids by applying the castor oil compress. This would be a good size for the abdomen. So for endometriosis, it'll break up endometrial pockets, it'll break up cysts, it'll break up fibroids. And as you heard today, it's also important to balance the hormones. So balance the hormones, because that's that high estrogen that causes those growths, and then apply the castor oil compress. And we've seen ladies helped again and again with that. You can also use a castor oil compress on the chest if there's a congestion in the chest. You could wear it on the abdomen, not only for fibroids, but also for constipation. I met a lady who told me she'd conquered her irritable bowel with castor oil compresses. She said, my husband's a doctor and I was not interested in what he had to offer. And I'd heard about the castor oil. So castor oil can be used in so many areas. If someone's got a sore knee, they might do a ginger poultice one night, they might do a potato poultice the other night, and then another night they might use the castor oil, and just observe what your body likes. I've had in my thumb a little bit of rheumatoid arthritis, because I have inherited the genes there. If I wear this castor oil compress every night, it never causes me any trouble. I've been wearing this compress. Well, I haven't been wearing for 8 weeks because my hand was in plaster for a while, but I've been wearing this one I've got on now for several weeks. So you can use it again and again. In the morning, I'll touch it and I'll look at my finger, and if I see oil there, I know it's still got enough oil. But if it starts to get a little bit dry, I'll put another maybe teaspoon of oil on it. Maybe after another month I might make another one. When it starts to look a bit sad, you might make another one, but you can use the same compress for several weeks.
And that's the power of castor oil and turmeric, a simple, natural combination that can make a big difference in your health. Whether you're easing inflammation, soothing discomfort, or breaking down unwanted growths, these remedies work in harmony with your body for lasting benefits. I encourage you to try them and experience the transformation for yourself. If you found this helpful, please like this video, share it with others who might benefit, and comment below with your thoughts or questions. I'd love to hear from you. Don't forget to subscribe for more natural health tips. Let's continue this journey to wellness together.